A very good day. In this session, we are going to learn the first-line drugs used in the treatment of tuberculosis. Now, the problem with tuberculosis is we cannot use a single drug for the treatment. It has to be always in combination with 4 to 5 drugs. And the main reason being the development of resistance. So we are going ahead with the 5 drugs, that is Isoniazid, Rifampicin, Ethambutol, Pyrazinamide, and Streptomycin. The important areas you need to know about these drugs are mechanism of action, route of administration, the site of action of these drugs, whether the drug is cidal or static, the metabolism profile of these drugs, side effects, uses, and other importance. So let's begin with Isoniazid. Isoniazid, in abbreviation, it is also called as INH. The mechanism of action of isoniazid is on the cell wall of the mycobacterium. The mycobacterial cell wall is mainly made up of mycolic acid, and isoniazid is known to inhibit this mycolic acid synthesis. The route of administration of isoniazid is mainly oral drug, and it comes as in the form of tablets. The site of action of isoniazid is it acts both intra and extracellular, that is, inside the macrophages and as well as outside the macrophages. And isoniazid is cidal in nature. It means it kills mycobacterial organisms. The major metabolism of the isoniazid is it undergoes acetylation. And one thing you should remember is isoniazid is an exception where it undergoes first phase 2 reaction followed by phase 1 reaction. And the phase 2 reaction which it undergoes is called as acetylation. Pharmacologically, acetylation status is very important because there are certain people who acetylates faster and there are certain other groups who acetylate slower. So that's why it is very important to know the acetylator status. The major side effect of isoniazid is hepatotoxicity. It's known to raise liver enzymes and it's known to damage liver and cause hepatitis. And hepatitis or hepatotoxicity is mainly seen in fast acetylators. It is due to that fast acetylators will metabolize the drug faster, and the metabolite of isoniazid called as acetylhydrazine tends to accumulate in the liver. And this acetylhydrazine would in turn cause hepatotoxicity, and hence it is more common in fast acetylators due to rapid metabolism. Whereas the slow acetylators are more prone to cause peripheral neuropathy. Peripheral neuropathy, usually patient complains of numbness and tingling sensation in the limbs. As the drug tends to be in the blood levels for a long time in slow acetylators, and they are more prone to cause peripheral neuropathy. Isoniazid is mainly used for tuberculosis. It's used in prophylaxis, that is prevention of tuberculosis in high-risk individuals, and as well as treatment of tuberculosis. And other important things which you need to know is, one is acetylator status, and second is pyridoxine supplementation. Now, why the patient on INH needs pyridoxine? The major reason being the patients who are having or those who are taking INH, they tend to have peripheral neuropathy. And the peripheral neuropathy, the reason being is INH is known to inhibit the synthesis of pyridoxine. And this could lead to pyridoxine deficiency, which in turn leads to peripheral neuropathy. One thing you should be very clear that pyridoxine is vitamin B6, and to overcome this peripheral neuropathy, now prophylactically always it comes in combination with pyridoxine. Now let's move to the drug number 2, Rifampicin, also called as Rifampin. The mechanism of action of Rifampin is different from isoniazid. Rifampin mainly focuses on inhibiting DNA-dependent RNA polymerase, and thereby it inhibits the RNA synthesis. The route of administration of rifampin is mainly by oral route. It comes as tablets. The site of action of rifampicin, like isoniazid, is both intra as well as extracellular, that is, within the macrophages and as well as outside macrophages. And the cidal property of rifampicin is bactericidal, that it kills Mycobacterium tuberculosis. And the major metabolism of rifampicin is through liver enzymes, that is, it gets metabolized by CYP. And more importantly, the most important drug interaction you need to remember is rifampicin is a potent CYP inducer. It means it would have some of the major drug interactions. And the important side effects which is associated with rifampicin is hepatotoxicity. Now, isoniazid also causes hepatotoxicity, so this is another drug which can lead to hepatotoxicity. Another side effect is reddish-orange color discoloration, that is, urine, sweat, and saliva can turn orange. And that's why it is very important to give patients sufficient knowledge before they start the therapy that this drug is bound to cause orange discoloration, otherwise patient would panic. Unlike INH, that is isoniazid, rifampicin have other uses too, apart from tuberculosis. Rifampicin can be used in the treatment of H. influenza B meningitis, and not only in the treatment, but the most important use is in the prophylaxis, that is in the prevention of H. influenza B meningitis. The third use of rifampicin can be used in osteomyelitis caused by Staph aureus. And another important use of rifampicin is in brucellosis. In brucellosis, the major treatment would be doxycycline, and this doxycycline can be combined with either streptomycin or it can be combined with rifampin. Now, other points you need to know about rifampicin is drug interaction, and most known drug interaction is when you combine rifampicin with oral contraceptives. When you combine rifampicin with oral contraceptives, it leads to contraception failure because rifampicin induces the metabolism of estrogen and thereby reducing its efficacy, and which finally results in pregnancy. And the second interaction could be with warfarin, because when you combine with warfarin, it would reduce its level and decreases the efficacy of warfarin, and the INR ratio, that is international normalized ratio, with warfarin may reduce. Now let's move on to the third drug, that is ethambutol. Ethambutol, like isoniazid, is known to inhibit mycolic acid synthesis. But in particular, it has been shown that ethambutol inhibits one particular enzyme called as arabinosyl transferase, and thereby it inhibits mycolic acid synthesis. Ethambutol, like isoniazid and rifampicin, is available as an oral tablet. The site of action of ethambutol is both intra as well as extracellular. But one unique thing you would find with ethambutol is the activity. The antibacterial activity, what you see with ethambutol, is bacteriostatic. And that's why in the whole group, in all the first line drugs, ethambutol is the only drug which is bacteriostatic. And as for the metabolism is concerned, ethambutol is not metabolized and it is excreted unchanged in urine. The important side effects which are associated with ethambutol are retrobulbar neuritis. So it's known to cause retrobulbar neuritis, and thereby it can lead to red-green color blindness. And that's why patients who are on ethambutol, we have to be very careful, and if they experience any red-green color differentiation or they are difficult to differentiate these colors, then they need to report it to physician. And another important side effect you can see with ethambutol is hyperuricemia. It tends to increase uric acid level. So because of the retaining uric acid level, it can precipitate gout. Ethambutol is mainly used in tuberculosis. And the other important points you need to know about ethambutol is this drug should be avoided in children less than 5 years. The main reason being the children cannot differentiate between red and green, or they cannot report the color blindness. and that's why you should not be given in children. The fourth first-line drug is pyrazinamide. Pyrazinamide, like isoniazid, is also known to inhibit mycolic acid synthesis, but the further mechanism is not still clear. The route of administration of pyrazinamide, like other drugs, is oral, but one unique thing you would find at the site of action for pyrazinamide is it only acts inside the macrophages. It means it can kill only mycobacteriums, those are present within the macrophages, and it is not useful against extracellular mycobacterium. And pyrazinamide is a bactericidal drug, means it kills Mycobacterium tuberculosis. The metabolism of pyrazinamide is mainly in the liver, and also most of the drug is excreted in kidney. And pyrazinamide, as it is metabolized in the liver, and it is tend to be hepatotoxic, so it's known to increase the liver enzymes. Hence, you should remember that there are three first-line drugs in tuberculosis which are known to cause hepatitis or hepatotoxicity, and those three drugs are Isoniazid, Rifampicin, and Pyrazinamide. Now, another important side effect which is similar to Ethambutol is hyperuricemia. It is also known to increase blood uric acid level and can precipitate gout. And the major use of pyrazinamide is in tuberculosis. Now, moving on to the fifth and final drug in the first-line drug category is streptomycin. Streptomycin is no different drug, as you know, it is an aminoglycoside. Streptomycin, as it belongs to aminoglycoside, so mechanism is it acts by inhibiting 30S ribosome. Now, what it does is it binds to 30S ribosome and it inhibits the initiation complex. So as there is no initiation complex, or it is deformed, so eventually it will lead to misreading of codons. And this misreading of codons will lead to dysfunctional proteins which are toxic to the bacterial cell wall. And the route of administration is unique for all the aminoglycosides, that it is given by intramuscular route. And another interesting property of streptomycin is, as it is large compound and it is highly polar, and that's why the action of streptomycin remains extracellularly, because it cannot penetrate the macrophages. And streptomycin is also a bactericidal drug, and most of the streptomycin is excreted unchanged in urine. Now, the side effect is the same side effects which are shared by all the aminoglycosides, and these side effects are ototoxicity. Ototoxicity constitutes vestibular toxicity and cochlear toxicity. Vestibular toxicity, usually patient complains of loss of balance, vertigo, and cochlear toxicity, usually patient complains of hearing loss, and which usually starts with high tone deafness. Another important side effect of streptomycin is nephrotoxicity, and that's why you have to be very careful, and you need to do dosage adjustment in case of people who are having any renal failure, and especially in case of elderly. And the third side effect is neuromuscular blockade, which would cause neuromuscular weakness. And the major uses of streptomycin is it's a first-line drug in tuberculosis. Second use is it can be used in plague caused by Yersinia pestis. It can be used in the treatment of tularemia. Fourth use is in brucellosis. As I want to repeat here again, doxycycline is the main treatment, and it is usually combined with streptomycin or rifampicin. And one more use I want to quote is it can be used for endocarditis, and usually it is used along with penicillin. And one thing you should remember is combination of aminoglycoside with penicillin is synergistic, and that's why they are very useful in the treatment of endocarditis. So this finishes general overview of anti-tubercular drugs. Thank you very much.